So, good evening, everyone. This is the 1841st day of continuous daily webinar conducted by International Forum for Promoting Homeopathy. IFPH comprises of homeopathic students, lovers, and doctors. So, let's begin the session with a silent prayer. Thank you, everyone. So just a quick announcement that you all know that we are celebrating 5th anniversary of IFPH on 28th September at Kerala, Cochin at Taj Vivanta. So I request everyone to uh, register their name for that celebration. So as you all know, IFPH is conducting 3 uninterrupted sessions every day from 7:30 to 10:30 p.m. The recording of the sessions is getting uploaded on the very next day so that who missed the session can watch it and get benefited from it. Also, you can subscribe the channel without paying any money. Today's our guest speaker, I would like to introduce her on behalf of IFPH. I welcome Dr. AMRUTA ANIL. She has done MD in homeopathy and diploma in psychology counseling. She is working as a lecturer at Homeopathic Medical College, Maharashtra, and also she is serving to homeopathy as a consultant at Anand Clinic, Dapoli, Ratnagiri, Maharashtra. She is having more than 5 years of clinical and teaching experiences. So today's her topic is role of homeopathy in menopause. I would like to request Dr. Amrita to begin the session and share her knowledge and experience with us so that we all can get benefited from their session. Over to you, madam. Please continue.
Thank you, ma'am. Good evening to all the respected members. Thanks for the warm welcome, ma'am. I can see many more respected practitioners over here. Your knowledge and experience will definitely help me in my upcoming future. So, my sincere and heartfelt gratitude to the IFPH Forum for giving me this wonderful opportunity to take a webinar on the topic that touches every woman's life journey called menopause. Myself, Dr. AMRUTA ANIL HON, in deeply inspiration by Dr. Samuel Hahnemann, the founder of homeopathy, whose vision on holistic healing which help in the understanding of menopause. So menopause is not only the we can discuss menopause not from the medical point of view, but also empowering the life with the natural and integrated approach towards the healthy aging. Okay, so today we will break the myths and bring the awareness about the menopause. In this session, we can explore the physical, emotional, psychological challenges at this stage. We can also discuss the holistic care with homeopathic system of healing based upon Hahnemannian principles. So let us begin this journey of knowledge with an open discussion. I welcome to all of you.
Ma'am, excuse me, ma'am.
Yes,
Ma'am, can you uh, do it is at in slide so, and then it will be on full screen, so it would be more visible
ma'am.
from current slide. Huh. Okay, ma'am. Yes, ma'am. Thank you.
Is it okay?
Yes, ma'am. Yes, ma'am.
Okay. So what is menopause? Menopause is nothing but a transition from the reproductive to the non-reproductive life. Okay. This word is basically derived from a Greek word which means pause. Pause means a complete cessation, and that is a complete stoppage. And in this menopause, it is a purely physiological process. It is nothing but abnormal or anything which is artificial. Okay, so every woman has to go from this phase of her reproductive life. So menopause is the end of menstruation. Menopause is the part of woman natural aging process with her ovaries produce very lower level of estrogen and progesterone, and after that she no able to become pregnant after that menopause. Okay, so when we want to define a menopause in a very simple word, we can define it as menopause means a permanent cessation of menstruation at the end of her reproductive life due to loss of some ovarian follicular activity. So it is a point of the time when her last menstruation occurs. We can also define it in a very simple way that menopause is a permanent cessation of primary function of human ovaries. Okay, I hope this definition is clear to all of you. Say, then what is the age of menopause? The age at which menopause occurs is genetically predetermined, and it is not related to the age of menarche, okay, or it is not related to her last pregnancy, lactation, use of oral contraceptive pills, and also upon the socio-economical condition, race, height, and weight. Okay, so in India and Philippines, the median age of natural menopause is considered as at least at 44 years. Okay, then what? Sometimes that the patient or the lady might be having habits of cigarette smoking or severe malnutrition. It may cause early menopause. The age of menopause is 45 to 55 years. So we can take average at least 50 years. Sometimes there is condition called surgical menopause or artificial menopause. I will discuss these two terms, that is surgical menopause and artificial menopause, in my later slides. Now we will discuss what are the phases of menopause. Menopause is divided purely into 4 phases. First is premenopause. Okay, the stage which occurs before the menopause is called as premenopause. This is broadly defined as the entire woman's life before the menopause. What happens during this stage? During this phase, the woman have regular periods, can bear children, and the sex hormones like estrogen and progesterone, they retain in a steady balance. Okay, in the simple words, when we want to explain this premenopause, she can enjoy her normal reproductive life, means she can bear children, she can have her normal reproductive life, and in this phase the both important hormone, that is estrogen and progesterone, they always maintain a steady balance. So this stage is called as premenopause. Then second stage is called as perimenopause. So what happens in this stage? In perimenopause, it can begin 8 to 10 years prior to the menopause. In this stage, the ovaries, they produce less estrogen. So what happens in this stage? The ovary, they produce less estrogen, so there is less folliculogenesis. Okay, so generally this stage mainly starts at the age of 40s and it lasts until menopause. At this stage, the drop of estrogen increases, with women experiencing many symptoms like hot flushes, night sweat, and so many symptoms which are experienced in the pre-menopause stage. Sometimes there are chances that she can become pregnant if she is still experiencing her menstrual cycle. So we have discussed the second stage, that is called as perimenopause. Then the third stage is menopausal phase. So it is the end of menstruation. At this stage, this stage is mainly occurs between 45 to 55 years. Menopause refers to the specific period, and this is the last period. Once woman has gone through this period of 12 consecutive months without experiencing a menstrual cycle, it's called as menopause. Okay, so when she has not getting her regular menstrual cycle for at least 12 consecutive months, we called it as a menopausal phase. This is a pure clinical definition of menopausal phase. Then there is a fourth phase which is called as post-menopause. Okay, so it is a time after which a woman has experienced 12 consecutive months of amenorrhea. In this stage, she has already experienced menopause. She has already gone through the various stages of menopause, and now she landed into the post-menopausal phase. Like I will discuss what are the symptoms which are related to the each and every phase of her reproductive life. So these are the 4 phases of menopause. This is premenopause. Second one is perimenopause. next one is menopause, and last one is postmenopause. Then we will discuss what are the types of menopause. Menopause is basically divided into the two types. First is physiological menopause and another is pathological menopause. This pathological menopause again divided into premature menopause, artificial menopause and delayed menopause. I will discuss what do we mean by premature menopause, artificial menopause and delayed menopause. First is natural or physiological menopause. In this process, this is purely physiological process. Nothing abnormal or nothing artificial is going to happen in her body. This is the natural process of her aging or natural process in the reproductive life. Second stage is called as pathological, which is also called as premature or early menopause, surgical or induced menopause, and delayed menopause. So when we want to discuss what do we mean by physiological menopause, in this process, what happens? It is a normal decline in the ovarian function due to the aging. Okay, it mainly begins in the most of the women's between age of 45 to 55 years. Average, we can take it as a 51 years. So it happens due to result in infrequent ovulation, decreased menstrual function, and there is eventually complete cessation of her menstruation. Okay. In this, there is decreased menstrual function, and in finally, there is complete cessation of her menstruation. Then when the second stage comes, that is pathological menopause or type of menopause. In this stage, there is gradual and abrupt cessation of menstruation before the age of 40 years, which occur idiopathically. This is most commonly seen in 5% of the women. Most commonly 95% of the women, they are experiencing a physiological menopause, but there are some women in 5% category, they can also go on through a physiological menopause. Then when we call a condition called as abnormal menopause, okay, in this phase there is nothing abnormal, but due to some various clinical reasons, the menopause come sometimes may come earlier. So how can we detect this condition? In this condition is called as premature menopause. A woman's ovaries are completely stop working at a very early age, ranging anywhere from the age of puberty to the age of 40 years. This is known as premature ovarian failure. Okay, I will again repeat. This is called as premature ovarian failure. Means in this stage, the ovary they cannot function properly. Either there are various clinical conditions like CA or anything which is completely hampering her ovarian function. So in this stage, the menopause may come very earlier. So we can call it as a premature menopause. And in a delayed menopause, if the menopause fails to occur even beyond the 55 years, it is called as delayed. In some patient, this we are see when the patient comes in our OPD, she gives the history of, madam, I have continuously bleeding at age of my 55 years or 60 years. So there are chances that she is facing the situation called as delayed menopause. Then what are the causes of menopause? There are nothing very abnormal causes or anything which is related to the unnatural. Menopause is purely basically very physiological process. So it occurs, why it occurs? Menopause occurs when the ovaries are totally depleted of her eggs and no amount of stimulation for regulating hormones like FSH and LH. So there is a natural decline of reproductive hormones. Now, we will discuss what is the exact pathophysiology of menopause. I hope up till I have cleared what do you mean by menopause, what is the definition of menopause, what are the four stages of menopause. Then we have discussed about what are the four types or what are the various types of menopause: physiological as well as pathological. Now we will discuss what is the basic physiology of menstruation as well as menopause. So what happens in this phase? Hypothalamus releases gonadotropin hormone like GnRH, that is gonadotropin releasing hormone, which mainly stimulates the anterior pituitary to produce gonadotropins like FSH and LH. This FSH and LH plays a very important role in the ovarian cycle. Okay, then this FSH is mainly acts upon the primary follicle, and after passing through the various stages, it reaches up to the Graafian follicle. And with the help of LH, this Graafian follicle releases the ovum. Okay, so the remnant of Graafian follicles forms a corpus luteum, which again produces estrogen as well as progesterone. So these two hormones prepares a very nice endothelium for the zygote. If the fertilization occurs, the corpus luteum slowly degenerates. If fertilization not occurs, then this corpus luteum slowly degenerate and it leads to the shedding of endometrium, which is called as menstruation. Okay, this is a simple pathophysiology behind menstruation. Hypothalamus secrete gonadotropin, which acts upon the anterior pituitary. The anterior pituitary will release the two hormones, FSH and LHS. They act upon the ovaries. This is a basic physiology behind the menstruation. During the menopause, during the menopause, what happened? Exactly opposite condition is happening in the menopause. So during the menopause, there is no folliculogenesis. Okay, no folliculogenesis means no ovulation is going to form in the ovaries. So no corpus luteum is formed. So no estrogen and no progesterone. So the endothelium is completely become atrophic. Okay, and this atrophic endothelium does not shed. That shedding of endometrium is given in the form of normal bleed or normal bleeding. So in this stage there is complete endometrial atrophy, so the patient experiences the amenorrhea. So this is the basic pathophysiology behind the normal menstruation or normal menstrual cycle, and second is the climacteric phase, or it is also called as menopause. This pathophysiology is very important. Now we will discuss what are the physiological changes which are takes place in our female reproductive cycle or in the female body. There is a lack of estrogen and progesterone, which causes many changes in women's physiology that affect their health as well as well-being. The symptoms of menopause due to the changes in the metabolism of the body. So there are sometimes very metabolic changes which are occurring during this phase. The cholesterol level may be high in the blood, so it is called as hyperlipidemia, or there is increased level of cholesterol and lipids in the blood, which is absolutely very common. This leads to a gradual rise in the risk of heart diseases as well as stroke after the menopause. So in this stage, the lady has to take a very she has to become very cautious, that she has to maintain her body weight. She has to take a proper nutritional diet, so that there is very less of cholesterol in her body. There is chances of osteoporosis. In this stage, calcium loss from the bone is increased in the first 5 years after the menopause, resulting in loss of bone density. The calcium moves out of the bones, leaving them a weak, liable to fracture at a very small stress. So there are very chances that she may land into the osteoporosis or may suffer from symptoms which are related to the osteoporosis. Then what are the changes which are related to the digestive system? In this system, there is motor activity of the entire digestive tract is diminished. After the menopause, the intestine tend to very sluggish, resulting in constipation. So the lady may come in our clinic with the history of severe constipation, or there may be altered bowel habits. Sometimes diarrhea alternate with constipation, or the symptoms which are purely related to the digestive system. Then she may also complain symptoms which are related to the urinary system. So what are they? As the estrogen level decreases after the menopause, the tissue lining of the urethra and the bladder become very drier, thinner, and less elastic. So this can lead to the increased frequency of urination as well as increased tendency to develop UTI. So at this stage, patient comes with the severe history of urinary tract infection. So she give the clinical history like dysuria, painful maturation, or sometime there may be hematuria, or may if she is having a history of any renal calculi, then she will experience that renal colic or symptoms which are related to the urinary system. Then there are various changes like other system that are changes which are taking place into the genital organs like uterus. Uterus is very strongly affected in the menopause. So what happens with the uterine endothelium or uterine mucosa? The uterus become very small and fibrotic due to the atrophy of muscles after the menopause. The cervix become very much smaller and appear to flush in the vagina. In older women, the cervix may be impossible to identify separately from the vagina. The vaginal and cervical discharges decreases in the amount, and sometimes they later disappears completely. So these are the changes, physiological changes, which are taking place into the uterus or uterine endothelium. When we scan a patient, or when we send patient to do ultrasound of her uterus, we can see the uterus become very much atrophic, and there are various changes which are taking place into the uterus. Then what happens with the ovaries? The ovaries, they become smaller or atrophic or wrinkled in appearance. The ovaries, which produces a little androgen during the reproductive life, begin to produce it in an increasing amount. And in the vaginal mucous membrane becomes very much thin. It loses its rugosity after the menopause. Decreased secretion may make vagina very dry at this time. Sexual intercourse become very much painful and difficult due to the pain from the dry vagina. So these are the physiological changes which are takes place in the ovaries as well as vagina. Then what happens with vulva and external genital organs? The fat into the labia majora and mons pubis decreases, and the pubic hair sometimes they become very spare. In the breast, a thin built woman, the breast becomes very fat, flat, and wrinkled. While in the heavy built women, they remain very flabby and pendulous. So these are the changes or physiological changes occurring into the vulva and breast. Now, we will discuss about what are the symptoms of menopause. These symptoms are clinically very important. Patient gives all the clinical history which are purely related to the menopause. She experiences severe headache, then systemic weight gain. Patient give history like, ma'am, I have gained my weight extremely in my during this phase. She can easily make out. So then there is heavy night sweat, palpitation, breast enlargement, severe pain in breast. Then skin become very much dry. There is excessive itching, thinning of the skin, tingling and numbness in the skin. Joint, they become very painful joints and severe soreness, stiffness in the joint. Patient also experiences severe back pain during the menopause. Then there is urinary incontinence and urgency of urine. Sometimes there is cough reflex. When she coughs, she may experience the urinary symptoms. This is absolutely very normal in the case of menopause. Then sometimes along with this physical symptoms, the lady also experiences some psychological symptoms like dizziness, uninterrupted sleeping. Sometimes she may land into the insomnia or excessive sleepiness due to disturbed sleep pattern. She also experiences weight gain or various symptoms like anxiety, poor memory, inability to concentrate, mood disorders like bipolar mood disorders, irritability, mood swings. Sometimes she becomes very much aggressive or she becomes sometimes excessively silent. So you cannot predict her mood. So there are various mood swings. Sometimes she experiences less interest in sexual activities. Then there are transitional menstruation, shorter or longer cycle. Patient come with the history of excessive menorrhagia or amenorrhea, or sometimes she also experiences a dysfunctional uterine bleeding. So this phase is called as transitional menstruation. Either there is shorter cycle or the cycle they become very much longer. So sometimes she also experiences bleeding between the period. So you can easily diagnose the case of DUB in the case of menopause also, or in the premature menopause stage also. Then in the vagina, there is excessive vaginal dryness and painful sexual intercourse. These are the exact clinical symptoms or the clinical history which is given by each and every patient who is going through the stage of menopause. I hope up till now I have cleared what are the symptoms which are related to the menopause. Then, after discussing the so many symptoms, now we will discuss what are the various skin changes which are seen on in the lady who is experiencing menopause. The skin loses its elasticity and becomes very much thin and fine. This is due to the loss of elastin and collagen from the skin. Weight. Then severe weight gain is more likely to be seen as a result of irregular food habits due to her mood swing. Okay. This is there is more deposition fat around the hips, waist, and buttocks. Then hair they become excessive dry and coarse after the menopause. There may be hair loss due to the decreasing level of estrogen. Estrogen is very important in maintaining our health, hair quality or hair texture. So when there is less estrogen, the hair they become excessive dry. If she is suffering from any thyroid disorders like hypothyroidism and all, she again experiences the symptoms which are related to the hair fall or excessive dryness of the hairs, or hair may become very much brittle or they break easily, or various complaints which are related to hair or hair follicle. Then sometimes there are changes in the voice become some very deeper due to the thickening of vocal cords. She may experience some voice changes during her menopausal stage. Then hot flushes. This is the most important symptom which is experienced by each and every lady who is passing through the stage of menopause. Hot flushes. Hot flushes are incidents where the woman in the menopause gets a sudden feeling of warmth and flushing that starts in the face and quickly spread all over the neck and upper body. We can make out from the picture that she is very become the lady become very much restless. She has a great desire for fanning and from a close distance. So hot flushes is very important symptom in the menopause. These hot flushes can occur at any time of day or night. They vary in the number from one in every hour, 1 hour, or at least every 15 minutes. The hot flushes are often associated with profuse sweating. Hot flushes, they are followed by profuse sweating. Patient also experiences night sweat. So what is this night sweat? Generally, we experiences severe sweat during daytime, but during the menopause, she has disturbed her sleep cycle, so she also experiences the night sweat. Night sweat are closely related to the hot flushes. Both usually occur simultaneously. Hot flushes and night sweat, they occur simultaneously. Sweat can occur at any time of the day or night. They are also common in the night. The sweat can be severe enough to wake up the woman from the sound sleep and make it difficult her to go back into the sleep. So she is experiencing very disturbed sleep pattern. The sudden waking up from the sleep can cause palpitations and sometimes panic attack. Due to excessive insomnia or a disturbed sleep pattern, she experiences severe palpitation or sometimes panic attack. So night sweat and hot flushes. These are extremely unbearable symptoms which are experienced by each and every patient who is going through the phase of menopause. Then, along with this, we have seen or we have discussed the symptoms or the changes which are take place into the into the various systems. Now we will discuss what are the symptoms which are related to the psychological changes. Psychological changes are mainly manifested by frequent headache, irritability, fatigue, depression, and insomnia. Although these are often said to be due to the changes in the hormonal level, they are more likely to be related to the loss of sleep due to the night sweat. The lady experiencing severe night sweat, so she sometimes may complain of complete insomnia, and due to which on the next day she may feel frequent headache, irritability, sometimes excessive fatigue or low energy, or sometimes there may be the mood changes or bipolar mood disorder. Diminished interest in sex may due to the emotional upset or may be secondary to the painful intercourse or due to the dry vagina. So these are the various physiological changes that are takes place into the menopause. I will again revise: depression, anxiety, fatigue, irritability, memory loss, problems with the concentration, mood disturbances, and sleep disturbances. Insomnia, sometimes she may experience sleepiness or aggressiveness, tensions, phobias, low self-esteem, low confidence, and tearfulness. She may always narrating her complaints with severe weeping and all. This is these are the various psychological changes which are takes place into the lady. Then what are the various causes which are related to the mood swing? These basically mood swings are due to the first hormonal changes, sleeplessness, stress, sexual dysfunction, changes into the body, and negative attitudes towards the aging. Okay, these are the main causes or the causes which are related to the mood swings. Then up till now we have discussed what are the what are the psychological changes. So if the what are the now it's time to discuss about what are the social changes during the menopause. The feeling that the woman holds upon about herself and her social relationship as well as the symptoms she experiences can be defined by culture in which she has lived. Women vary in their subjective experiences of symptoms. Not all of the women perceive the changes in her body are reflected in the mirror. Some are derived from the woman's perception of herself based upon the amount of others' expectation. It can vary. So each and every patient is a patient's reaction to the menopausal symptoms is very different. Some ladies or some patient they enjoys this phase very nicely, or they can go through or they can pass from this phase very easily. But some patients they take it as a social stigma, or they can withdraw herself from the society or social contacts. So some we have categorized young woman, middle woman, elderly woman, how she is facing this menopause. So we can make out from this picture. Menstrual symptoms in a young woman, they are cramps, pain, bloating. That is, bloating means a severe heaviness into the lower abdomen, and fatigue, mental fatigue as well as physical fatigue. In the middle-aged woman, symptoms are severe and frequent, like hot flushes, mood swing, night sweat, irregular period, vaginal dryness. In the elderly woman, common symptoms during the menopause are weight gain, depression, and osteoporosis. We can make out from these three pictures very easily what are the phases of menopause. I hope I'm not going too fast. Anybody can reply? Hello? Then we'll discuss what is the diagnosis of menopause. Diagnosis is purely based upon the clinical history, that is complete cessation of menstruation for consecutive 12 months during the climatic period, appearance of menstrual symptoms like hot flushes and night sweat, vaginal dryness. When then we want to done if we want to done a biochemic assay or her hormonal assessment, we have to rule out what is her serum estrogen or serum FSH and LH level during the menopause stage. Then in the last part of how you are going to manage a patient of menopause. Up till now, patients come with the history of symptoms which are related to the menopause or the symptoms which are purely experienced by the patient. So how you are going to manage? Management of menopause is purely non depending there are two types of management. One is non-hormonal treatment and another is hormone replacement therapy. In the non-hormonal treatment, we do a lifestyle modifications, nutritious diet, supplementary calcium, exercise, vitamin D, and complete cessation of smoking and alcohol. This is called as non-hormonal treatment. And in the hormone replacement therapy, um, first we will again discuss about non-hormonal treatment. Like there are variety of menopausal treatment, both natural and medical, that can elevate the symptoms of menopause. Dressing up in the light layers can elevate the hot flushes and night sweat. Avoiding caffeine, because caffeine may sometimes induce insomnia. Complete avoid of alcohol, spicy foods. It can also minimizes the symptoms. This is a non-hormonal treatment. Menopause and weight gain tend together due to the lifestyle changes, due to the hormonal changes or lifestyle changes. Reducing the dietary fat intake and regular exercise help to combat with the weight gain during the menopause. In the menopause phase, the lady experiencing a changes severe osteoporosis. So at this stage, it is our duty or duty of physician to give her proper calcium or vitamin supplementation, magnesium, vitamin D, which can also help to restore the bone density, which naturally deteriorates after the age of 30 due to the reduced estrogen level. Menopause decreases vaginal elasticity, leading to vaginal dryness. Vitamin E can also help, along with some Kegel exercises, to restore the elasticity. Using water-based lubricants during sexual intercourse also minimizes the discomfort related to the vaginal dryness. Menopause often leads to the dry and itchy skin, weak and thin hairs that breaks easily and had a lot of split ends. So we can prescribe a patient flaxseed oil, which is found or which helps to restore her skin and healthy appearance along with vitamin E. Then the last and most important part during the treatment or management of menopause is hormone replacement therapy. It is indicated in all the menopausal women to overcome short-term as well as long-term consequences of estrogen deficiency. HRT can be administered orally into the pill form, or it can be given vaginally as a cream or transdermally in a patch form, because it replaces the female hormone produced by the ovaries. Hormone replacement therapy also minimizes the menopausal symptom. It can be used before, during, and after the menopause. So this HRT or hormone replacement therapy is very important in the management of menopause. So, what are the types of HRT? How you are going to give the HRT or hormone replacement therapy to the patients who are suffering from menopause? First is estrogen and progesterone. Most common types of HRT involve estrogen and progesterone. During this therapy, estrogen is given regularly while progesterone is added as a supplementary basis. These two hormones are given in combination in order to prevent the overgrowth of uterine lining. Estrogen alone sometimes can irritate this lining, which could be lead to the endometrial carcinoma. Estrogen only therapy alone is usually given to the women who have lost their uterus due to the surgical menopause. Okay, sometimes we have to remove, or we have patient has gone some hysterectomy due to carcinoma or DUB or whatever may be the reason, because the no uterus is present, so no need for the progesterone is not as agreed. Then progestin only. Progestin only therapy is not prescribed very oftenly. Progestin does not seem to provide excellent relief for the woman plagued with hot flushes. So, available preparations for HRT are commonly used estrogen are, we can give it as conjugated estrogens. Okay, it is given in a 6.5 to 1.25 milligrams per daily. Progestin are used as medroxyprogesterone. It is given in 100 and 300 milligrams per daily. Considering the risk of hormonal therapy, it should be used with the lowest effective dose and for the short time of period. Low dose of oral conjugated estrogen, 0.3 milligrams, given daily as an effective pill, but and has got a very minimum side effect. Then there are subdermal implants are also available during the menopausal treatments. What are they? Subdermal implants are inserted subcutaneously over the anterior abdominal wall using local anesthesia. It is given in the form of 17 beta estradiol implants, which is available in the form of 25, 50 or 100 milligrams, and it can be kept for 6 months. Then percutaneous estrogen gel, it is given in 1 gram applicator of a gel, which is delivering 1 gram of estradiol daily, which should be applied into the skin over the anterior abdominal wall or a thigh. Then duration of HRT. Generally, HRT is a short period of time which is given for 3 to 5 years, which is advised. Reduction of the dose should be done as soon as possible. It is contraindicated in the patients who are suffering from breast cancer, undiagnosed genital tract bleeding, estrogen-dependent neoplasm, DVT, active liver diseases, jaundice, gallbladder disease, and endometriosis. Then earlier we have discussed the condition called surgical menopause. So, surgical menopause, it is a induced menopause in which both ovaries are surgically removed. Either there be CA endometrium, or there are patient, sometimes the patient may suffering from severe DUB, or she herself want to go or opt for hysterectomy. This is so in this case sometimes we have to remove her uterus along with ovaries. So this condition is called surgical menopause. In surgical menopause can occur at any age before her natural menopause occurs. The symptoms of surgical menopause are generally more intense than the woman occurs there naturally. Sometimes induced menopause are due to the abrupt cut of her ovarian hormone. Due to sudden onset of hot flushes and other menopausal symptoms such as dry vagina and decline of sex drive. So this hormone replacement therapy is used to treat the symptoms which are induced by menopause. It stops or reduces the short-term changes of menopause such as hot flushes, disturbed sleep, and vaginal dryness. So if we want to give health education for the patients, or we cannot call them as a patient, the lady who is enjoying or going through the phase of menopause, what things we should advise her. Women at the menopausal stage need to support it very emotionally. They need a proper counseling. It should be educated about how to manage a sign and symptoms of menopause. This may also help them to overcome the symptoms which are related to the anxiety and depression. certain lifestyle modification is necessary to prevent the occurrence and minimizes the effect which is associated with this condition. Then what is health education? We should encourage her for do her regular exercises, encourage family members to give her emotional support to prevent depression, encourage to take a healthy and a balanced diet, encourage to practice relaxation techniques and to get over the enough sleep to avoid the insomnia. So last but not least, menopause really isn't that bad. Okay, so every woman has to go through this phase. So she should enjoy this phase. She is not going to be worried or not going to get panic in this stage. So as a physician or as a homeopath, it is our prime duty to educate her that this is absolutely normal, nothing to worry about it. You have to just go through it very calmly and silently. Okay, so this is the first part of my webinar that is purely related to the definition of menopause, types of menopause, phases of menopause, and now we will discuss what is role of homeopathy if time permits. Hello, Dr. Dinesh sir.
Yes, we can. You can talk a little more if you want for 5 minutes.
Yes sir, yes sir. I hope this is very clear up till now.
This is really.
Yes, ma'am.
Okay.
It was really very much informative and well presented. Okay, this topic.
Thank you, ma'am.
Thank you, ma'am.
If you have a case, you can present.
Yes, sir. I just want to give what is the homeopathy or what we are going to. We are not dealing with the patient. We are not dealing with the symptoms actually. We want to deal with the patient. So what are our remedies like ignatia, nitromood? So what are their phases and how the remedy we are going to what we are going to come to that constitutional medicine. Just wait a minute.
Otherwise, we can have a discussion and then we can have a
Okay.
second part.
No problem. Tomorrow we'll discuss or about what is the exact role of homeopathy in the menopause. Actually, I want to share all the remedies which are purely related or which we can prescribe in the menopause, and along with the case presentation that I will do tomorrow or if time permits in the next session. Is it okay, sir?
Yes, yes, definitely we can have. Over to Dr. Sudhi Sariga.
Yes, sir. I request all the participants, if they have any problem, they have any doubt, they can either write in the chat box or they can unmute and ask directly.
Ma'am, please
Yes.
stop the screen sharing so that we can see. Yes, sir. Really, this is a very important subject we discussed today, and we are very happy to have such sessions because uh, homeopathy can do wonders with the treatments of women, particularly those affected in a younger age, that is at menarche to menopause. There are a lot of problems the female fertility faces, and it is our duty to choose the right medicine according to the symptoms rather than simply naming the disease, as rightly pointed out by ma'am here. And definitely, a lot of things need to be improved in our part because our doctors have a lot of knowledge in different subjects, but only very few are expertise have the expertise in particular field, particularly
Only
in.
I want to explain that our remedies like lactasis, sepia, sulfur, gluonine, they are very, very well indicated in the case of menopause. So we have to prescribe on not only upon the symptoms, we have to consider the patient as a whole. when we are dealing with the patient according to the Hahnemannian principle. We are not going to treat the hot flushes or night sweat. We have to deal with the patient, how she is facing that situation. That is more important in the case of menopause. How is she is dealing with that psychological symptoms, or how she is dealing with that phase, that we have to consider, and that is the psychodynamics behind the menopause.
Yes, most of the people not aware about this menopause. That's the reason why when
Sometimes they
lot,
take it as a social stigma, or they become very much panic, or become very much anxious, or sometimes she may land
yes,
in depression.
usually from the husband or the other family members may not realize what is happening with this lady when she was a very nice woman in the early part, but
Suddenly
now
what happens?
all of a sudden she become overactive and she become angry and she's always quarreling with the patients, and sometimes just opposite. They're the same, totally may in a depressed condition.
Yes,
So it is our duty to give a narration to the family members that this is the reason she is having no psychological psychiatric problem, but instead she is suffering from this menopausal syndrome. Yes,
Yes, sir.
yes,
Yes,
doctor.
sir. One more thing I also want to add that that you pointed very correctly that apart from this, the patient, we need to give this education, this information to their family members also, close family members who can support
understand
them also.
what's
That is
up.
very important for this time hormonal imbalance, to support them with emotionally or and physically also.
Yes, ma'am. Yes, ma'am. It is the duty of all the family members to support, enjoy this space. So it is not a, it's a teamwork. You can call it as.
Yes, exactly. There's Sridhar Button from Homeopathy Fraternity. He's a deputy director, retired from the CCR. So welcome, Sridhar sir.
Yes, thank you, sir.
Thank
Uh,
you. Good
Thank
evening.
you, madam. It was a excellent, very detailed regarding that the menopause
Thank
symptoms.
you, sir. I need your guidance in your future.
And we have done a study about 5 years in Central Research Institute regarding menopause. So
Okay.
many complicated and unsolved problems going with that homeopathic medicine. So we have a very good chance to cure so
Yes, sir.
many
Yes, definitely. With the
all type of the symptoms we can,
yes,
especially the sexual problems and the hot flashes and all other symptoms we can definitely cure. It is a good area, we can do it anyway.
yes.
Thank you very much. Next time you bring some, if it is possible, some
Yes, sir. Cases. Yes.
cases also,
Yes,
that
sir.
it will
Sure,
give
sure.
to the newcomers. It will be very helpful.
Sir,
Thank you
sure.
very much. Come again for our
Thank
next
you, sir.
section.
It's a
Thank
great
you very much.
pleasure for me, and thanks for giving me such a wonderful platform to present a webinar on the menopause. I will try to do my case presentation in the next consecutive webinar. Thank
I
you.
am stopping here because there is only
Thank
4 minutes. If there is some others want to talk, let them to speak about that. Okay, thank you.
you. Thank you. Once again, thank you to all the respected members. Thank you, sir.
Dr.
Yes.
Ramprasad sir want to say something.
Thank you, Dr. Daneshji and Dr. Surti Sarika. Everyone, namaskar and congratulations, Dr. Amrita Anil.
Thank you, sir. Thank you so much.
Deeply explanation, cause and effect menopause.
Thank you,
And
sir.
this is the medicine. This
Thank
is
you.
the medicine. Menopause during uh, subjective symptom and objective symptom change
Yes, yes,
due to harmonious disbalance, है
yes,
ना?
yes, sir.
Harmonial disbalance. So lifestyle is a very
Hello. Hello.
good advice,
Yes.
and जो है, so very very thanks,
Thank you, sir.
Dr.
Seri.
Amrita
Thank you,
Anil.
sir. Thank you
Thank
so
you.
much. Thank you.
Thank you, sir. Also,
Hmm.
I want to say that in my little bit practice only,
Yes,
uh, during menopause, na, sometimes urinary infection is also so much common.
yes,
So that time also with allopathic medicines that can't be cured. So with homeopathic medicines, it is very wonderful to see that how the persons who were suffering for this recurrent urinary infection, and with simple 3-4 doses of lachesis that I used according to the symptoms, and it did miracle to her, and she was so fond of this homeopathic medicines that with years of allopathic medicines for her recurrent urinary infections, it was not curable, and with just few doses of homeopathic medicines, it was totally curable. So in many cases, during all symptoms, all ailments during menopause related to that, we can cure it very wonderfully. So I am very much looking forward for your next session to see some remedies and some case presentations for that. So
My presentation, the positive results with the homeopathic medicines like lachesis, gluonine, or nitromune, or our constitutional medicines, and the lady that is enjoying her menopause very peacefully and calmly.
yes, ma'am. It was very wonderful to hear you, and it was very informative and very much enriching sessions. And it was well structured this session. And
I will try.
I'd like to thank you on behalf of IFPH it, uh, for your nice presentation and and your experience that you shared with us. So thank you very much, and I'm very much looking forward for your next session.
Okay, ma'am.
I'd like to say Dr. Dhanesh too if he wants to add a little bit more.
Yes, really an excellent session indeed, and congrats, Dr. AMRUTA ANIL, for such session. Definitely, some 2 weeks, 1 week later, we can have the second session as per your convenience,
Yes,
so
sir.
that
Sure, sure.
you can come up with some more cases here.
Yes,
And as we know, that you all know that the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th of September. That is just 2 weeks away from now. Hope
yes.
all of you will register for the same, rupees 3,000 per person. And there will be a lot of presentations, discussions, and particularly papers on veterinary homeopathy, dental homeopathy, and agro homeopathy, and as well as a discussion time for question answers, time for students to interact with the senior doctors and international faculties also. Hope all of you come join us on the same day. Hope all of you register as early as possible. Thank you, the participants, once again. Hope
Thank you.
tomorrow we will have a session from Dr. Deepthi Gilla, and she will be presenting a beautiful session tomorrow. She is a research officer as well as a assistant professor in CCRs.
Okay, sir. Thank you. Once
Thank you,
again,
thank you, Dr. Sudhi, for your excellent moderation this evening.
Thank you, sir.
thank you,
Thank you.
ma'am.
Now our international English session is getting over. I am handing over this session to Malayalam session. Thank you, everyone.